Also new for this afternoon, it is fall, and you know what that means. Sneezing and itchy, watery eyes for so many here in East Tennessee, and our kids as well. We're talking fall allergies with Dr. Ryan Redmond from Children's Hospital. Always good to see you.
Yes, thanks for having me.
Sniff.
Yes.
What are the signs and symptoms to look for in our kids?
Yeah, so allergies in kids present often the very same way that they do in adults, with the kind of itchy, runny nose, stinging eyes. Sometimes you'll get a little bit of redness there, but it's usually confined to kind of the upper airway. There shouldn't be a lot of lower respiratory things, trouble breathing, anything like that. Allergies are more kind of up in the head is what we think of those.
Okay, so this year especially, how do we distinguish between allergies, common cold, and COVID-19?
And that is become a big concern because, as we know, sometimes COVID-19 illness in children can be fairly mild. So teasing out those symptoms can be a little bit difficult. However, one of the hallmarks is going to be fever. Allergies should not have fever associated with them. The time course too, allergies tend to be more of a kind of a chronic low-grade kind of thing, rather than you're fine one day and then the next day you're really sick. So both of those things hint more at a viral infection.
What about asthma and allergies, that connection? Does one cause the other?
They don't necessarily cause the other one, so allergies don't necessarily cause asthma, but there is an association. Certainly people who have allergic reactions tend to have the same type of mechanism that can cause asthma in their lungs. So if you do see trouble breathing, that is something that you need to get seen for right away to tease out that difference.
Very scary. Yeah, you want to nip that for sure. So let's go down just a really brief checklist for kids suffering from allergies or asthma. What do we parents need to do?
So a lot of it is, of course, related to environmental exposure. The more that you're out there in kind of the environment with pollen and all that kind of stuff, the more severe symptoms tend to be. So what you can do is help kind of get rid of that. So when it's not saying you shouldn't go outside, but when you go outside, you should come in, you should take a shower or a bath, kind of get that pollen out.
It's a lot.
Certainly before bed, because when you're sleeping, and if you get all that on your pillow, and that's going to be added exposure. So that's going to be important. And then also, certainly some of the over-the-counter medications can be very helpful as a first-line thing. There are kids who are certainly more affected than that, and oftentimes having the help of an allergist can be useful at that point.
And maybe injections, the allergy shots.
And those are all the things that they can, take that next level with for things that are really severe.
Here in East Tennessee, a lot of people have allergies.
Absolutely,
All
yes.
right,
Yeah.
Doctor, thank you so much. If you have a question about your child's health you would like for us to get answered for you, email me at ltucker@wate.com. And then, of course, tune in right here on WATE 6 on Your Side every Thursday at 4. You never know, we might answer your question on the air.